everybody will be calling. So if you have a tool that can discharge of 50 to 80% of the traffic in the call center, that's a help that everybody can benefit.
Welcome to Startup Health TV. This is a COVID-19 health innovation update. I'm Logan Plaster, editor of Startup Health magazine, and I'm joined right now by Cristian Pascual, CEO and co-founder at Mediktor, based in Barcelona. I'm excited to hear what you're working on there at Mediktor, and we're just going to dive in to a quick 5 or 6 minute update on what you're working on. So Cristian, thanks for joining me today.
Oh, my pleasure, Logan.
So first of all, where are you? A more personal question to get us started, kind of how is this impacting you personally and in your business?
Well, this is strange times. We are having tough days, and of course we are not, to do telework is not our usual thing. We are Latin, we like to touch people, to hug them, and it's difficult to be away of the team, but we have been able to work good enough with the video connections and trying to keep up. But we are really busy these days.
Yeah. So my understanding, Mediktor is a symptom checker that really, if you're sick and you want to go online, you want to figure out, okay, what's wrong with me? What should I do next? It really takes you from symptom to, I've heard you say, from symptom to action in a matter of minutes. So talk to me about kind of where the product is right now, and then you can segue into kind of what you're doing around COVID-19.
Okay, so Mediktor started a long time ago. That was 2011. And we have been working in this, we call it medical assistant, because we provide triage, pre-diagnosis, and decision-making support. So the same tool, the same engine, can be used by patients to guide them from the first symptoms to the best action. That's our main outcome. But also you can use the same engine to provide decision support to physicians or to just medical staff. So in essence, we try to gather the symptoms from the patient related to the disease and provide this relation as an outcome on how fast you need to seek care, and of course provide the list of the possible conditions you could be suffering and a level of urgency.
Okay, so if I am feeling sick, I'm nervous that I have COVID-19, how is this better than me just Googling my symptoms?
Well, I think better than Googling your symptoms is almost anything that you can do. But the thing here is that this is not a simple test, which we could see these days, that you have just 4 questions, 5 questions asking the typical symptoms of the COVID-19. This goes long farther because we do a differential diagnosis using our 800 disease database. So you can start the assessment. Of course, you will go for the COVID-19 typical symptoms, but can ask also to other related symptoms, which is nice because what is happening is that everybody thinks that has COVID-19, but most of the people that use a symptom does not have it or not showing the symptoms properly related to COVID-19. So that's a big relief. That's, on our experience, 80% of the times when users use our assessment related to COVID-19, find out that there's no COVID-19 in the list of possible conditions. More than this, when you have the possibility of having it, what is important is to separate when it's severe and it's not severe. So in a not severe situation, you can stay at home, and the best would be if you could be tested at your home, better than going to a hospital and do all the saturation that we see these days. And if you have urgent symptoms, then yes, you need to seek care as fast as you can. So call emergency, do the protocols that are applied locally, or just run to a hospital. So this is the game, but as we play it on differential diagnosis, I think it's more it provides less anxiety to people that does not suffer the disease, but still thinks that could suffer.
Got it. So you're based in Barcelona, there in Spain. How have you rolled this out specifically as a COVID-19 product? How have you worked with local authorities, et cetera?
Well, first of all, we got the interest from our clients. We work with 7 health insurance companies all over Europe, and also with institutions in the US that we work. Everybody was requesting this tool. And we have been dealing now with the national authorities, and we are in conversations to roll out this solution with them, and also talking to other health institutions worldwide. So we are now in many conversations with many organizations that are willing to help citizens all over the world.
Now, my understanding, correct me if I'm wrong, is there's 2 ways to interact with the product. As a patient, I could just come onto your website and I could try out the symptom checker. I could dial in what I'm feeling, but then you also have it as a B2B product as well, so that a company could use your engine as kind of like the brain behind their symptom checker. Is that correct?
Right. I mean, we have the test available in our website, and everybody can use it for free. But this is not our business. We do it just to help people, and also to learn from every interaction, and learn how people deals with the system. But we offer our technology that can be embedded to any interface, from voice to chat, plain chat platforms, apps, webs, whatever you have, we can embed our technology, white label, so can be a seamless experience to our clients' users.
Who's your ideal partner then? So if your main business isn't direct to consumer, it's not about me feeling sick and dialing up Mediktor.com. You want to be integrated into somebody's system. So what's the ideal partner for you during this pandemic?
Well, I mean, we can really help a lot of people dealing with governments, but that's a tough deal to go. But we are working with some potential clients as governments. But I think everybody in the health industry is trying to help. So health insurance companies, payers, health systems, everybody is willing to give this advice. And also we help all these institutions with the problem that is coming, that all call centers will be rated. Everybody will be calling. So if you have a tool that can discharge of 50 to 80% of the traffic in the call center, that's a help that everybody can benefit without.
Gotcha. So it's really not just about this COVID-19 assessment tool you built. It's really about the ability of the platform to risk stratify and triage a bit, keep people at home who are low risk for other things.
Exactly. I think that this crisis has put into light something that it's obvious for a long time for me, but it's really, I've seen many companies struggling to really develop the potential. I think that healthcare has been a physical business for a long time, but have not used the full potential of being digital, which provides a more scalable and flexible solution. So I think this crisis will shift and change this mindset. And because it's a real need to fight against this pandemic, we need these tools. So I think it will be the day before and the day after of this pandemic, a huge adoption of telemedicine solutions as a great tool to benefit everyone.
That's awesome. Okay. Well, I think that's the time we have. If people want to learn more about the symptom checker itself, is it Mediktor.com, I assume?
Right.
And
exactly.
the best way to reach out to you, obviously they can find you at startuphealth.com. We have different ways of reaching all of our companies, but is there another way that people should reach out to you as well?
Well, they can email me or just use the general email info@mediktor.com, and we will kindly respond to anyone.
Awesome. Okay, Cristian, thank you for taking the time. Appreciate all the work that you're doing there at Mediktor, and I wish you the best there in Spain.
Thank you, Logan. Thank you very much.
All right, take care.